Physicians Advisory Group. Good morning, Dr.
Guys, thanks for having me on.
So we are taking you once again to the doctor's office over at One Love Pediatrics. So it's been a couple weeks now, Doc. First of all, happy holidays to you and your wife and your growing family.
Thank you. You too, guys.
Yeah. How is foot traffic at the clinic? Just with with the holidays coming up, and we're in the middle of sports season for kids and everything like that. I'm sure as a pediatrician, is this normally like a busy time for you guys?
Oh, normally, yeah, right around October through February gets to be a very busy time, just pre-pandemic, just because there's a lot of cold viruses around, and that hasn't changed at all. We're still seeing a lot of cold viruses coming around. Some have been, I guess there's some testing done, so the parents have found out that there's RSV, rhinovirus. I've seen some parainfluenza stuff causing croup coming around. And generally, the kids tend to look pretty okay. They're just gonna have 3 or 4 days of cough, fever, runny nose. But the concern with some of these viruses are they can go down to the lower respiratory tract. And so that's a lot of my visits about a lot of precautionary measures and what to look out for. And so I saw a kid with some viral pneumonia, which is a possible complication of just a regular cold. And a couple of cases of mild bronchiolitis that they need to be hospitalized. Again, complications of cold.
And I want to say you more than any other physician that we had the pleasure of interviewing, going all the way back to last year, was you were really stressing right in the middle of this is pre-coronavirus vaccine and everything. You were like, please everybody come in and get your regular flu shot because flu season's coming up and you don't want there's this coronavirus thing and then you don't want the flu on top of that. So I mean you were really driving that message home.
Yes, definitely would recommend the flu shot. So, last year in 2020, with everybody on lockdown and wearing masks, flu was, I did not see any flu in my clinic. Definitely had less people coming into the clinic as well, but flu worldwide was on a huge historic low. This year, we're a little bit more mobile. We're still wearing masks and people are pretty good about not coming out again when they're sick. But, I expect it to pick up. I haven't seen any yet. I'm sure GMH has already, though, with the testing that they do. Flu, just as a reminder, it can put healthy kids into the hospital, and we see this every year. So that's one where the illness is can be a little bit more severe. And so, especially if we have infants, you have to be at least 6 months to get the flu shot. But if we're an infant between 6 and 12 months, I highly recommend that they get the flu shot just because you don't want to deal with that. Flu can be super nasty.
Yeah. And subsequently, like last year, we actually saw, I believe it was like record lows for the number of flu cases that we had just because everybody was, staying inside. So, the word got around.
Yeah. It was great to not see kids sick with flu. So yeah, everybody did a really good job last year. And this year it looks like, at least recently the corona cases have been, really dropping, which is fantastic. And I heard there was an outreach over at Father Duenas, I think over the weekend that I heard did really well. And so I think the word's getting out and parents are getting their kids up to get vaccinated. So hopefully we'll get to a point, sooner rather than later where coronavirus or COVID becomes endemic, so it's become something a lot like the flu and cold every year that we might see these little influxes, but it won't overwhelm our hospital system and hopefully just won't be that big of a deal. So hopefully get there eventually.
Are you, by the way, administering the pediatric vaccine?
We're trying to. So I'm not, I put in the application with public health. I'm not already within their network. And so they need some temperature data from my vaccine fridge and then the application from us. And I think if everything goes smoothly, hopefully within a week, but I know we're coming up on the holidays, so I'm expecting a little bit of a lag for that. But I do have families that are waiting to get the shot at my clinic. I would strongly encourage that you guys can get it at any of the other clinics as well. They'll also take a good care of you guys, but that's why I'm getting the shots, because some families are just saying they feel more comfortable doing it in my clinic.
Yeah. What are some of the common questions that parents are asking you regarding whether or not their child should be given the shot?
Oh, by far the most common one is, is it safe? And by now, I think most people understand that, yes, these have been tested. We've seen that overall it's been very safe. And then the question that is a little bit harder for parents to kind of conceptualize it are the long-term effects, right? Oh, the mRNA vaccine, they haven't heard of it before. Is this going to be safe long-term? And the way I kind of like to frame my answer for that is there's a couple baseline things we have to know that we have to just kind of understand. Number one, viruses just as a class can do really weird things, right? We have viruses that can cause cancer, like HPV and hepatitis, they can cause cancer. We have viruses that are associated with mental illness. They think some sorts of cytomegalovirus can cause schizophrenia. Measles can wipe out your immune system. Chickenpox can live in your body for your rest of your life and come out as shingles. The viruses can do weird things. And COVID is a brand new thing and we don't know. Generally, we think coronaviruses, aren't going to be having terrible side effects. But again, COVID is brand new. We don't know. On the other hand, vaccines in general have a very good long-term safety profile. There's not really any vaccine that you can look at and say, oh, you know what, people that got this shot ended up with, whatever, like the whole autism thing was debunked, a decade or so ago. And the only thing I can really think of was the oral polio virus, which nobody gives anymore, because in some immunocompromised kids, it was a weakened live virus and they were actually getting polio. So we don't give that anymore. So keeping those two things in mind, then the question is, all right, on one hand, the mRNA vaccine is in your body for just a few days. The mRNA does not have to go into the nucleus and mess with the DNA. It just gets absorbed in the cytoplasm and then makes the ribosomes make the little proteins and then you make the antibodies. And then the mRNA is pretty fragile. So after a few days, it goes away. On the other hand, we have COVID and we know that can stay in your body for up to 2 weeks. And in the worst case scenario, has killed a lot of people. And we're seeing from over the past year and a half, 2 years now that we have neurologic complications, cardiac complications, blood clotting issues, et cetera. And so when I tell parents that, when now we're kind of on a baseline understanding, I say, if you had to decide and you had to guess which one was going to cause a long-term complication, most parents are going to say, oh, it's probably not going to be this vaccine that stays in your body for a few days, goes away, and generally, like, vaccines don't cause a problem. It's going to be this virus that's been causing a lot of problems the past couple of years. When I spell out that way, a lot of parents it seems to make a lot more sense to them. And I have to remember that, the way I think of things as a physician who's been seeing complications of things, parents, I would say not just parents, most people would typically say the acute infection is what we're trying to prevent. A lot of times, though, with most of our vaccine preventable illnesses, it's the complications that are actually the really scary part. And so, with this being such an unknown, that's what we're trying to protect for our kids. Of course, everybody hopes that there are no long-term complications of COVID and nothing's going to happen. But, with this being so early, I'm not sure that's the safest choice to make right now.
Now that's from the parents' perspective, but Doc, what are you getting from when you actually talk to the little ones who the parents bring in, and you kind of see, and keep in mind, I was a hypochondriac. If you were trying to give me the booster when I was a kid, I'd be shaking so much it would break the needle.
You'd be surprised. A lot of the kids. So we had one of our patients. She wanted to be the first kid in her class to get the COVID shot. She
Nice.
settled for being the first girl in her class to get the COVID shot, and she was telling her friends that it didn't hurt. My arm wasn't even that sore, and so her friends wanted to get it. One thing I've noticed, I had a patient the other day who was, having a lot of anxiety about going to school, a little bit older. She was a teenager. And one of the things I asked her was like, what's making you worried? And he said, she was really shy. I said, it's COVID-19. And when I said, are you guys vaccinated? Surprisingly, they said no. And then when I told them, you're old enough, you can get the shot. And if you get the shot, the chance of you being hospitalized is almost zero. And the chance of dying is really, really close to zero. She looked really surprised and was like, can we go get the shot? So I think the kids are a lot more resilient and not as exposed to a lot of the misinformation that's possibly out there. And what they see this as is, I get a lot of other shots, and I get a lot of other shots that adults tell me are good for me to protect my health. And why now there's a shot out there for me, and I think it's my turn to get the shot. But
Do you,
that's just happened to be my clinic. I don't know. I can't speak for all the other
yeah.
clinics.
Do you see a lot of peer pressure within within youth groups and everything like that to either go pre booster or
Oh,
vaccinated or
not
unvaccinated?
really. No, not really. I'm sure it's rather than big groups, it'll come down to friend and family circles, right? So I know some families are just going to be like, oh yeah, everybody in my household and all my extended family got the shot because we have a new baby. And not speaking for me personally, but they have a new baby and they wanted everybody to be protected. And other families are just going to say, we didn't think it's that big of a deal. So I think it's on a much more family by family basis.
Doc, we asked this of Dr. Nguyen earlier. The Guam Education Board, Guam Department of Education, they're all considering the possibility of returning all students back to face or possibly just high school students. As a member of the Physicians Advisory Group, pediatrician, are we ready to bring all our kids back?
We haven't discussed this as a member, as a PAG as a whole. Just as a pediatrician, though, with the cases being so low, and I think the teen vaccination rate is actually fairly high. And we already know that in general, they do pretty okay. And the other thing I've been surprised to notice that the kids are pretty good about wearing masks and following the rules for social distancing in general. And so, with that in mind, I think it's very possible and very realistic to bring kids back. I'm really hoping that the cases are so low right now that you're really hoping, but staying cautious that this might be maybe our last bump. But Europe's going through like their fourth wave right now, and if and when tourism opens up, that'll introduce another wrinkle into the whole calculus of things. But for now, it seems reasonable, and I still don't think we've had major outbreaks at schools, even when we did open up before, right? So I think they showed that the proof of concept is working.
Mm-hmm. And since you are a member of the Physicians Advisory Group, and I'm sure you've been part of the discussions and making the recommendations to the governor, who makes the ultimate decisions in terms of what direction and how we're going to move forward in terms of the COVID response. We did have Dr. Ho again, as I mentioned earlier, saying kind of doesn't necessarily make sense that, for example, we're still continuing this separation with unvax and vax. You can go to the restaurant, but if you're unvax, you got to eat outside. But at the same time, if you have a social gathering at your home up to 25 people, you can have vax and unvax mingling together. And so maybe you can help as a member of the PAG to make sense of it.
When we discussed it, what we want to do was, we've done so well, and we want to make some, relax some things, right? So, we didn't want to go full on, because the fear I would have is, let's say we got another thing that came in and another strain or whatever, and now we have to tighten things again. I mean, everybody, like worldwide, we're all so tired of the restrictions, and the hope would be, everybody just kind of says, all right, well, we've got this new strain, the cases are up, we got to do the right thing. But it's, we're seeing in the Netherlands right now, right? They're rioting, and the Dutch are pretty reasonable people. And people are just getting really tired. So we didn't want to open everything up and say everything is totally fine, and then say, oh, wait, something else happened. Like, oh, okay. Like we just want to make it step by step and not have to keep going back and forth. And so this was kind of the compromise we came up with.
I see. So does the data show that you're more likely to catch COVID mixing at a restaurant versus at home?
It's mostly with the restaurant, the indoor and outdoor, right? Mm-hmm. And the home, it's somebody's private home. So if they decide that they're going to take the risk, by themselves, that's fine. But in the restaurant, it's going to be other people you're going to be putting at risk, possibly. So.
Okay, yeah. I just wanted to give you that opportunity to kind of explain the rationale behind that.
Yeah, it was mostly, we're coming into the holidays, and everybody wants to get together. The cases are going down, and if we don't open up now a little bit, like when can we? Right? So, mm-hmm. I mean, Guam overall has been doing so great, and I think we all deserve a great holidays.
And I guess also then with regards to all the other covered establishments that the mandate is still in place that if you want to go, for example, to the gym, you got to be fully vaccinated. Is that necessary at this point, in your opinion?
I personally like that one just because the gym is a little bit more contained and there's a lot of people breathing very hard. So I personally like the gym being vaccinated. That makes me feel a lot safer when I go to the gym.
Okay. And also just this in the latest guidance, and I believe we did speak with the public health PIO, Janella Carrera, yesterday in an interview with Daniel Perez regarding this new mandate regarding sports that in order for, I guess, middle school students now, because previously I believe it was 16. Now, if you're 12 years old and 1 month, as Jason likes to continuously point out, you have to be vaccinated in order to play
I actually didn't
sports.
see that one and I didn't see the details of that one, but I would assume what they're aiming for is that certain sports are just going to be closer contact. And so, that's probably going to be the rationale behind that.
I see. Let me just read
And
it for our.
I don't know if it's going to be, was it all sports?
Yeah, so it's number 4 on the public health guidance that organizers of contact and non-contact sports events and activities must refuse to allow coaches and participants 12 years plus 1 month of age and older who fail to show proof of vaccination status as provided herein from participating in any contact and non-contact sports, trainings, or competitions. That sounds like if you're not vaccinated, you can't play. Right?
Yeah, that's what it sounds like. Yeah. I don't know. That wasn't, I guess that's the decision that they came down with.
And now some brought
Yeah.
to 12 years in 1 month. Now you're talking about, like swim teams and, like the soccer jamboree happens up the street from us. And, that goes all the way to like little kids. So maybe they're just, kind of like expanding the scope of who might partake in sports.
Yeah, probably. I think, the ultimate goal would be, right, let's get everybody vaccinated, right? So it's probably to encourage that, I would imagine. But I'm not sure what Janelle had to say about that.
Yeah, I
That's a
think
great
she
Daniel.
yeah, I think she said she
Yeah.
told Daniel that you're not vaccinated, you're 12 years old and up, no sports. I believe that's the summary. I don't want to be accused of false news or anything, but I believe that was the that's what was said.
Are you seeing, Doc, a lot of your patients come in and like have sports related questions, even like middle-aged kids,
No.
like high school?
No, not really. Again, like the teenagers that we get who play sports and they're like, oh, we need to get, we need to go get the shot. A lot of my teens have already gotten the shot. And so there's not really a huge thing where teenagers are like, oh, I'm refusing to get the shot and I'm going to sit out my season or whatever. So, and again, I think it's because, at that age, there's a lot of shots that they already get. So it's not anything very foreign to them.
I just thought about that, Brie, because like swim teams, right? Like I remember somebody brought that up, and I think I saw it was on Sports Illustrated, where there's like, if you're doing competitive swimming, do you necessarily need like the shot because technically you're underwater? But once the race is over, you got all those people at the end. Everyone's breathing super, super hard, and not exactly like 6 feet apart.
Yeah, it's not just actual competition time, right?
Yeah.
So you got like your.
Doc, by the way, are you a tier 1, 2, or 3 clinic?
I think I was designated. I don't remember, tier 2 clinic.
Tier 2.
I was still open back in 2020.
Yeah. Have you been reimbursed at all?
For the Binax, for the Binax and for the Abbots, we haven't. But I don't know. Sometimes like some of the insurances cover and some of them don't. So we just, see what happens. And the governor very, very early on was saying that, she was hoping that anybody that wanted to get tested could get tested. Situations have changed since then. At the very beginning, it was so hard to just find a test anywhere. But now we're down to our Binax cards, which are the little antigen cards that similar to the home. I think they're the same ones that home kits. The catch with that one, though, I've from what I've read with the statistics, it's great if people are symptomatic, not so great if you're not symptomatic because it works a lot like the flu or strep test. And so great if people are like, oh, I think I've been exposed and I have symptoms. Can I get tested? Not so great if they're like, oh, I think I've been exposed, but I don't feel anything. I'm totally fine. So that's the caveat I tell when I'm testing people. But so far, we've just been using on symptomatic kids.
Okay. So no, as a tier clinic, you guys haven't been reimbursed for some of the costs that you had to
No,
put
but
in?
I mean, yeah, I mean the materials are free, right? But it's the time and the counseling and the staff and the resources that need to use up. But I mean, at least the tests are free.
Yeah. I guess any final message to the community as we head into the holidays? Thanksgiving's on Thursday.
Yeah, just if you can get your kids vaccinated, that'd be fantastic. If you guys decide that's what you want to do, I think it's a great idea. That and with the cases being down, I think we can have a little bit more more enjoyable holidays this year. And then, but really the other thing is there are just a lot of other cold viruses, and unfortunately, because COVID looks just like a cold in many cases, take the usual precautions because you don't want to be faced with a bunch of tests or having to sit out of work once the holiday weekend's over.
Well,
go ahead.
Oh, I got one more. Doc, can you just spell a myth for us and everything? Because of course this is Thanksgiving week. Does eating turkey really make you sleepy? the big turkey fan.
Everybody seems to suddenly trip that path. After that urban legend came out. But I think I actually saw some studies where it's not really the tryptophan. We just eat so much. We just go into straight food coma. It's just your parasympathetic system just kicking in. And if you ate a little bit less and drank a little bit less, I don't think you'd get sleepy. I sleep every day though, so.
Well, you got to watch football, and you need your energy for next day because it's Black Friday, man. You need some energy to work the malls, man. I mean that's a full day's activity in and of itself.
Absolutely.
Is this
sounds like you
baby's?
got to get it all weekend lined up.
Is this baby's first Thanksgiving?
Oh yeah, absolutely. Yeah, we got got some friends and some family to see, and yeah, really excited to show them off. I wish I could have gotten was old enough to get vaccinated, but I think everybody else we're seeing are. So I'm really grateful for that.
All right. Thanks a lot, Doc, and happy Thanksgiving to you and your family.
All right, guys.
Happy holidays.
Thanksgiving.
Take care.
Okay.
See you later.
All right.
That's good stuff. That's a lot of stuff too.
Yeah, you really going for broke with that Thanksgiving turkey trivia question. I think I've heard you ask that quite a few times. And
I think your mic was also down for a good majority of it.
Yeah.
So
No,
I pushed it up towards the end.
No, have you guys heard that?